My weight went from about 320 up to 575. And that's when I said enough is enough. My name is Chris Zieniewicz, and I had bariatric surgery here at Robert Wood Johnson University Hospital in New Brunswick, New Jersey.
Initially, when I saw Chris a few years ago, he was suffering from severe obesity. He weighed over 500 pounds, had significant joint pain, significant medical problems.
Some of those medical problems had limited his ability to participate in some basic daily activities and routines.
When I first went to see Dr. Sadek, I was 575 pounds. Before he would do the surgery, he wanted me to try to lose about 75 pounds on my own. So that's when I joined the gym.
We put him through a very well-structured program, referred him to different specialties, and got him optimized and ready for surgery.
I was going there about 4 times a week. And between February and July, I managed to lose that 75 pounds. My first operation, I was 500 pounds the day of the surgery. And probably a year later, I dropped down to about 380, somewhere around there.
For severe obese patients, we use sleeve gastrectomies to stage the patient, bring them to a reasonable weight, and then we can operate on them for another procedure to get them to the weight that's desired.
He had success with his initial bariatric procedure, but with a degree of obesity that is difficult to treat, sometimes we have to escalate our therapy. After some discussion with Chris and reviewing his preoperative workup and evaluation, we determined that he was a reasonable candidate to proceed with a relatively newer innovation in bariatric surgery called the duodenal switch. For Chris, we proceeded with a modified duodenal switch, which provided more powerful treatment for his disease of obesity and obesity-related medical issues. It combines the benefits of a gastric surgical sleeve with a gastric bypass in a simplified and technically very efficient and safe way.
Now I've lost about 110 pounds, 120 pounds.
Chris is doing great. He's losing good weight and moving towards the right direction. Our goal is to bring him below a body mass index of 40, preferably below 35, which will decrease his risk of developing heart attacks in the future and developing significant medical problems and developing any kind of a malignancy.
My walking is much better. Life is much better. I'm able to do a whole lot more. I don't have trouble standing, like I used to have. I'm just able to do more and enjoy life better.